doing out there tonight? It's your guy, Mr. Talk 718 with Talk Life the podcast. Hello, ladies. How you doing out there tonight? I'd like to talk to you about what's going on in the black community. I'm always going to be talking about black women because I love you ladies so much, and I understand that you guys are the heartbeat of all black communities. So my job is to make sure I discuss issues that will build you up, from mental to health issues. It doesn't matter. I'm here for you guys. Okay, so today is part one of health conditions that disproportionately affect black women. These conditions often occur together or exacerbates each other, and they're striking black women hard. Around 7.6% of black women have heart disease, compared to 5.8% of white women and 5.6% of Mexican American women. This is according to the Center for Disease Control and Prevention. Data from 2011 to 2013, that's when this data was, this is when the data was collected. And in 2016, around 46 of every 100,000 black women died from stroke, while 35% of every 100,000 white women did. And while white women diabetes diagnosis rate is 5.4%, that number is 9.9% out of every 100 for black women. This is according to the CDC data. And from 1980 to 2014, it almost doubled. A group of risk factors known as metabolic syndrome increases a person's chance to getting these diseases. These risk factors include having a waist circumference of above 35 inches in a woman and 40 inches in men. High levels of triglycerides, fat in the blood, a low HDL, which is good, cholesterol levels, high blood pressure, and high fasting blood sugar. So when they're talking about these things, some of those things are also diabetes, because we got to remember, when you have one, you have the other most of the time, right? So someone must have at least 3 of these factors to be diagnosed with metabolic syndrome. But having even one can signal higher chances of getting heart disease, stroke, and diabetes. Those first 2 are particularly lethal, killing one woman about every 80 seconds. The black community obesity crisis is a symbol of just how at risk this segment of the population is. So when we talk about diabetes, we know in the black community, they have chicken places, they have Chinese restaurants, they have Caribbean food, they have Italian, they have Burger King, McDonald's, you name it, they got it, right? This is only in our neighborhoods because we allow these things to happen in our neighborhoods. In all actuality, we need to stop. We need to, when we see one of them restaurants opening up, we need to band together and we need to push them out, because we don't need it. It's only causing a death sentence to us because they put it in our neighborhoods. They already feel that we're lazy, so they do these things. And then to think about the supermarkets with, they don't have the best produce. They don't have the best meats, the best cuts. They don't have anything that's going to be good for us. So we have to travel outside of our neighborhoods to actually find healthy alternatives, right? And that's not really cool. So when they say it's killing one woman about every 80 seconds, I can understand why that's true, because in our communities, this is what's going on. The vast majority of African American adult women are either overweight or obese. And this is from Hilda Hutcherson, medical doctor, professor of obstetrics and gynecology at Columbia University Medical Center. While 37.6% of black men ages 20 or over are obese, according to the latest data, that number jumps to 56.9% for black women. Somebody tell me I'm going crazy. Listen to the number. 37.6% of black men ages 20 or over are obese, according to the latest data. That number jumps to 56.9%. That's almost 60% for black women. and it stands only at 36.2% for white women. Crazy. Various genetic components are likely at play with metabolic syndrome. For instance, some research points to a gene that might make black people more sensitive to salt, thus influencing blood pressure. But much of this issue is social. It's the foods we eat. Many communities don't have easy access to healthier options. I just said that. Dr. Hutchinson says a 2013 study in preventative medicine found that poor, predominantly black neighborhoods face the most limited access to quality food. Also, cities stress and adds that a lack of exercise can be a problem as well. If it's hard to get access to a gym or to the neighborhood, or the neighborhood doesn't have a park, or if it's not safe, guess what? You have lifestyle changes. And with lifestyle changes, like eating better, exercising, and stop smoking, can prevent 80% of heart disease events and strokes and lower people's chances of developing diabetes. This is according to the CDC. But clearly, that's sometimes easier said than done. It's very easy to talk about living a healthier life, but when you don't have the resources or you don't have the establishments to get you what you need, you're gonna always settle for what's there. So settling for Chinese food is real easy when the Chinese restaurant is down the block, but you don't have a really good supermarket to buy fresh, wholesome produce. So it makes it easier. And not to mention every corner, I'm from New York, every corner in New York have a bodega. And what's in the bodega? You go get you a ham and cheese, or you get you a chopped cheese, you get you a hero sandwich. You go out there and you get all these things, but it's not good for you. So this is where the issue resides. How does heart disease affect women? Well, despite increases in awareness over the past decade, only about half, 56% of women recognize that heart disease is the number one killer. Number one. Heart disease is the leading cause of death for women in the United States, killing 299,000, almost 300,000 women. That's in 2017, or about 1 in every 5 females' death. Heart disease is the leading cause of death for African Americans and white women in the United States. Among American Indians, Alaskans, Native Americans, heart disease and cancer cause roughly the same number of deaths each year. For Hispanics and Asian or Pacific Islander women, heart disease is the second only to cancer as a cause of death, 3 out of every 5. About 1 in 16 women aged 20 and older, 6.2%, have coronary heart disease, the most common type of heart disease. About 1 in 16 white women, 6.1%, black women, 6.5%, and Hispanic women, 6%. About 1 in 30 Asian women, 3.2%. What are the symptoms of heart disease? Although some women have no symptoms, others have. Angina, dull and heavy or sharp chest pain or discomfort. Pain in the neck, jaw, or throat. Pain in the upper abdomen or back. These symptoms may happen when you are resting or when you are doing regular daily activities. Women also have other symptoms, including nausea, vomiting, fatigue. Sometimes heart disease may be silent and not diagnosed until you have other symptoms or emergencies, including heart attack, chest pain, discomfort, upper back or neck pain, indigestion, heartburn, nausea or vomiting, extreme fatigue, upper body discomfort, dizziness, and shortness of breath. Arrhythmia, fluttering feelings in the chest. Populations. Heart failure, shortness of breath, fatigue, or swelling of the feet, ankles, legs, abdomen, or neck and veins. So ladies, listen to these things, man. If you have any of these symptoms, you could be having a heart attack, or you could be having a heart disease. You know what I'm saying? So please remember, if you have these issues, I need you to do me a favor and call 911 right away. The risk factors of heart disease: high blood pressure, high LDL, that's low density lipoprotein, cholesterol, and smoking are key risk factors for heart disease. About half of all people in the United States, 47%, have at least one of these three risk factors. Several other medical conditions and lifestyle choices can also put people at a higher risk for heart disease, including diabetes, having overweight or obesity, eating on unhealthy diets, physical inactivity, drinking too much alcohol. So everybody is so concerned about the Hennessy. Oh, we gonna get sipping, what's it called? Netflix and chill. You want to chill? You got a bottle of Henny. We promote that heavily. We promote all the unhealthy foods. We don't talk about vegetables at all. Everything is starch and meat. You know what I'm saying? Salt, very high salt intake, a lot of sugar, and then alcohol, and then if you smoke. So if you're smoking and you add all those things up, you are at a higher risk level to have heart disease, right? Now, how can you reduce your risk of heart disease? To lower your chances of getting heart disease, it's important to do the following. Know your blood pressure. Having uncontrolled blood pressure can lead to heart disease. High blood pressure has no symptoms. So it's important to have your blood pressure checked regularly. Learn more about high blood pressure by going to the CDC website. Talk to your doctor or healthcare team about whether you should be tested for diabetes. Having uncontrolled diabetes raises your risk of heart disease. You can also go to the CDC. Quit smoking. If you don't smoke, don't start. If you do smoke, quit. Simple as that. There's ways to learn how to quit. You can always go to the CDC website, cdc.gov, and search learn ways to quit. Discuss checking your blood cholesterol and triglycerides with your doctor. You can find that out by going to CDC website and finding out about that. Make healthy food choices. Having overweight or obesity raises your risk of heart disease. Learn more about overweight and obesity at cdc.gov. Limit how much alcohol you drink. So if you drink 2 a day, drink 1. If you drink 4 a day, drink 2. Manage stress. Ladies, I want to say one thing, right? I talked about stress and mental health in my last video. So I want you guys to go out and listen to it. It's really informative. The information is on fleek, right? It's dope. You know what I mean? But I didn't get too many people watching it because I'm assuming it was too long. So this is why this is going to be a short video. But I want to say, and I want to say this with all my heart, ladies, you women have more stress than a little bit. And then you put a smile on your face, and then you live your life like nothing is wrong. But I'm going to tell you, if you got stress going on, if you got things that's bothering you, things that's complicating your life on a daily basis, but you smile through it anyway because you trying to be this strong black woman, stop. Reevaluate the situation and get somebody to talk to. Because not only does stress cause mental health issues, it also causes heart issues. You understand? Heart attacks, high blood pressure, it can cause, if you're diabetic, stress also can make your blood sugar rise because stress is a silent killer and diabetes is a silent killer. So if you have anything that you need to talk about, get off your chest, don't hold it in. Stress will have you really, 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 really messed up. So remember, there's ways of coping with stress. And from my professional opinion, just life's lessons, I would suggest finding someone to talk to, seek out professional help, talk to your pastor if you're into religion, talk to a good friend that you know will keep your conversations discreet and secret. But don't hold on to it. Let it go. Let it go. Let it get out. Let it hit the air so it can dissolve in the air. because you don't want to hold on to those things. It causes more issues than you know. Okay? And I want to say to everybody that's listening, that's a part of the Talk Life family, I love you guys. I appreciate all your support. I want to say, if you are watching the video, like and subscribe. If you are listening to the podcast, please become a subscriber to the podcast. All love is welcome. All help is welcome. All support is welcome. But anyway, this is Mr. Talk 718 with Talk Like the podcast. I want to say thank you. I love you guys. God bless.